Well, good morning. How are you? Oh, I think this is a marvelous room. I am inspired to be with you. Marvin, I might say my heart is soaring to be with you all today. It is a great honor to be here with you and with my son, Harry Canan, who I just twisted his arm and said, sit with me while I make this presentation. You'll hear from him a little bit later. Thank you for the generous introduction, Marvin. Madeleine Dean, Congresswoman for the 4th Congressional District of Pennsylvania, which is suburban Philadelphia. Elected in 18, sworn in January of 19, it has been a busy 3 terms, shall we say. I am pleased and honored to be with you, the National Association of Addiction and Treatment Providers. This annual conference is inspirational to me in my own work. I hope you understand that. I was fortunate to meet some of you last night and to hear the wonderful presentations of awards. Literally, you lifted me. Your work inspires me. Decades of work in this important area at a time of national crisis. So I thought the theme of my little talk could be Congress can learn something from NAATP's focus on ethics, effective treatment, and continuing recovery. We could learn from you. Yes, a round of applause for you. I'm going to break my time into 3 areas. One is thanks and acknowledgement for your work in an extraordinarily challenging time. Second, a little bit about me, my story, my work in what is an extraordinarily challenging time in Congress. At breakfast, Harry reminded me that probably I'm surviving the dysfunction of Congress because I survived our struggle, and I'm the youngest of 7 children. So lots of dysfunction. I've learned a lot and learned how to try to deal with it. But I do want to bring you some hope from Congress, some hope around policy in this second piece of my talk, because there is a bicameral, bipartisan will to do better in public policy around mental health, addiction, overdose, poisoning, and all of the challenges we're facing. And then finally, the third piece of my talk will be what really brings me here today. I don't think it's because I'm a member of Congress. That's part of it. I think it's because Harry and I have lived it. Our family has lived it. What many of you have lived, more importantly, what many of the people you face, you treat, you care for every single day have been through. Extraordinary stories of struggle and extraordinary stories of hope and of recovery. That's what I hope we bring to you. So thank you to Marvin, I think he was there, I don't know where he went, Marvin Ventrell, Katie Strand, and your entire talented team of 10 at NAATP. Thank you, Jay Crossan. I saw Jay a moment ago. There's Jay, the board chair, and all your board members. A gorgeous diversity of board members, as we saw last night, reflecting the diversity of this calling. We have a calling for equity, a calling for equity of health care for all, and this country does not live up to it. I thank you for your passion, for your work. It really invigorates me and those struggling with substance use disorder as you strive for recovery for all. Again, we can learn from you. I love the use and the focus on ethics, efficacy, equitable treatment for all. As we saw in last night's presentations for the award recipients, I see cause for continued hope and joy. Harry and I thank you for the award you offered us and I had last year. And I have to say, I feel even more out of place when I see the likes of the folks who won the awards last night. Words matter. You better believe it. I'm a former professor of writing. Words matter, especially in this area of our world. DEI matters. You better believe it, especially at a time when we don't always prize diversity, equity, and all of the rest. Equity matters. Saving lives and seeing our common humanity is everything. That's what I think this is all about. It's about saving lives and, most importantly, seeing our common humanity. What one person struggles with, many others do too. You know, if we had met more than a dozen years ago, I don't think you'd recognize me. You certainly wouldn't see me as an elected official. I was a mom. I was a professor of writing for 10 years at LaSalle University, and you certainly would not recognize Harry. Back then, we were in a battle. We were in a struggle. I was an angry, afraid mother that felt like I was in the dark. My son was losing everything. All of his gorgeous gifts, his personality, his intellect, his charm, his friendship. And he was very sick. He was losing weight. He was sickly. We were struggling to figure it out while we were in a locked battle, frankly. I thought I knew something about mental illness. I thought I understood addiction as a disease. I thought I was on to what was going on and wrong with Harry. And man, oh man, it was not an easy road, and it took us a while. And I will say we were in it together. I have a husband, PJ, and Harry has two brothers, an older and a younger. We were all in the battle together, struggling to figure out what was going on and what was going wrong. The good news is that when we confronted him October the 30th of 2012 with what I knew in my core was the truth, that he was struggling with addiction, in this case it was addiction to opiates, would he get help? Would he accept our offering of help? And for the first time, he said yes. He had no other words. If you know anybody who struggles with addiction, they often have a fanciful way of answering you in a way that is not very, very, very true. We had come from an Irish background, and I always say that Bill Canan, his grandfather, would have been proud of the yarns that he spun. But on that day, October 30th of 2012, he's had no other word, just a tear print in his eye, and he said yes. It changed everything. I'm very proud of him. He'll tell you more about his story in a minute. Let me move to my part in Congress. As Marvin told you, and it sounds like a strange listing of caucuses and task force, but as a member of the House, I'm co-chair and founder of the Bipartisan Fentanyl Prevention Caucus, vice co-chair of the Bipartisan Addiction Treatment and Recovery Caucus, and member of the Bipartisan Addiction and Mental Health Task Force. I used to think that's too many caucuses. That's just too much. But you know what I have found? It's not enough. It's literally not enough to bring education and awareness, to bring us out of the darkness and ignorance that so often clouds addiction, mental health issues. So I'm happy to be active members on all of those caucuses and task forces. As you know, and we just went through the incredible statistics. More than 38 million Americans are living with substance use disorder. Less than 10% of those who need help get it, and I know it's complicated why that is. There's some obstacles in the way that I see over and over again, and you know far better than I. Stigma, shame, fear of seeking help, not enough beds, limited ways to pay for them, and a built-in too often injustice for people of color or people who are simply poor. So let's work to address these short-term, sometimes short-term issues, and address long-term changes to the industry, changes to our culture and our society. Number one, let's get insurance companies to cover and pay for the care that is health care. It is not something on the side, it is health care. Number two, let's address stigma and shame. You know, in the short term, we know addiction treatment providers are not adequately funded, and some insurers are making changes. But Congress, it's absolutely true, we have to do more in partnership with you. We can give treatment providers the resources to shorten those wait lists, open more beds, pay healthcare professionals well, and demand parity. It's been done before. Think back to the 1990s. The bipartisan Ryan White Comprehensive AIDS Resources Emergency Act created the largest federally funded program in the United States for people living with HIV/AIDS. This is how you commit to addressing a public health crisis, because we are in an extraordinary public health crisis. Addiction, overdose, poisoning is public health crises. More Americans have died of overdoses, poisoning in the past 24 years that have been killed in all U.S. wars combined. Insane statistics like that in the country that is the United States of America. In 2022, I'll use a different statistic. More than 110,000 people died in connection with overdose, not including alcohol-related deaths. I have for years called that a jetliner a day. Every single day, 365 days a year, souls lost in this country to the disease of addiction and or to poisoning. We can and we must ground that jetliner, just as they did in aviation when two planes crashed within weeks of each other, killing hundreds of people. The Ryan White Act provided specialized care for more than 500,000 Americans. Think of that. We need a Ryan White Act for the treatment of substance use disorder. In the long run, however, we want to make sure that Congress acts stronger, more swiftly, to enforce the parity laws. We need to ensure life-saving work can be done consistently and sustainably. We need to enforce these laws. We know insurers should be equitably and reliably covering SUD treatment under the Mental Health Parity and Addiction Equity Act, and the insurance companies know it too. Insurance companies must finally make the changes that they've been legally required to make for nearly 2 decades. I hope you will help me push back on the lobbies that keep us from enforcing these laws as they should be enforced. Yet you're too familiar with the violations: low reimbursements, high copays, claims getting denied that shouldn't have, and additional requirements that exist only for mental health and SUD treatment, separated out. As of now, the Department of Labor can only require employers to reimburse their workers after a parity violation. They cannot act against the insurance company itself. Last year, Senator Bob Casey and I introduced legislation, the MORE Act, Maximizing Opioid Recovery Emergency Savings Act, to lower costs for patients. The MORE Savings Act would require insurers offering individual or group health insurance to cover prescriptions and support services used to treat opioid use disorder. It would require insurers to cover recovery support services in conjunction with treatment at no cost to patients. It would establish a 5-year pilot program in 15 states to eliminate costs for people using Medicare opioid use treatment, reverse overdoses, and provide recovery support. The MORE Savings Act is still sitting in a committee, and we're still pushing it for consideration, pushing it to get to the floor. But you know what is going on in Congress. There is sadly a dysfunction. As I said, there is bipartisan support for these different pieces of legislation that many of us have introduced. But we need push. We need the push of all of the advocates, the providers, to make sure these bills get consideration, that these programs get funded. Please make your voices heard. Please contact me in my office. Let me know what you think is going to be most effective. I'll offer you one other bill. Congressman Donald Norcross of New Jersey is one of my colleagues on the Addiction and Mental Health Task Force. He's been introducing and reintroducing legislation to enforce parity laws for years now. His bill would give the Department of Labor a mechanism to enforce this law on insurance companies, not just the individual employers. These issues are life and death for young and old. The issue of Medicare, the rate of drug overdoses among Americans age 65 or older has quadrupled in the last 2 decades. These are issues for young and old, for advocates, providers, lawmakers, and the rest. I'm pleased that the Biden administration has been strong on trying to enforce parity, recently proposing a rule that would close the loophole in the law and strengthen parity by requiring more transparency and accountability. Insurers would have to show how their coverage rules affect patients by, for example, sharing denial rates for mental health care claims compared to other claims, and providing data on prior authorizations for mental health care claims versus medical claims. The administration has been one of the strongest in combating opioid addiction, overdose, and poisoning, alcohol, and other. Dr. Gupta, ONDCP, Dr. Delphine Whitman, SAMHSA, and their teams are extraordinary public servants I've had the chance to work with. They are clear-eyed about the opioid and overdose epidemics, and they are steadfast in prioritizing prevention, education, and long-term recovery. In 2021, SAMHSA established the first ever Office of Recovery within the administration. In 2022, as you well know, SAMHSA officially transitioned to 988, the Suicide Prevention Lifeline, to streamline crisis responses. And in fiscal year 2023, just last year, the administration invested nearly $8 billion in programs supporting overdose prevention. I've had the chance to speak with the president one-on-one, parent to parent, because he and his family know all too well the struggle of addiction and mental health crises. Finally, we need to work with treatment providers without talking. We can't talk about treatment providers without talking about the workforce. We know there is a dire workforce shortage across healthcare, only exacerbated by COVID, only exacerbated by the mental health cries of our patients and the SUD treatment world. These are challenging fields, as you know better than I. As a lawmaker, I want to make sure we're supporting our current workforce with fair pay, encouraging the next generation of doctors and nurses to go into addiction medicine, through tuition incentives for doctors and nurses going into addiction medicine, funding medical schools that offer comprehensive addiction education. And we have to continue to talk about it. Stigma. We need to end stigma in the medical care field as well as on the streets. That's why Harry and I talk about our story, our family story, his story of opioid addiction and recovery. We have to shed the stigma and the shame. Mental health care providers have talked about it for decades and decades and decades. Here we are 45 years into this very association, still talking about it. But we are making a difference. So keep telling your stories. We'll keep telling ours. I want to end with transitioning back to our story. Our story, and I don't like to use this word, and I'm going to ask our winner of the Journalism Award last night for a better word. We feel lucky as a family. Harry got into recovery, worked hard at it, had extraordinary good care. He went to Caron Foundation back in October of 2012, had extraordinary long-term care with competent, caring, excellent, ethical providers. He had a family who supported him. I'm very proud of his brothers who surrounded him. My husband, who was behind him, beside him, all the way. But everybody doesn't get that. Harry taught me an expression that I had never heard. When we talk about diversity, equity, inclusion, and belonging, he told me that he had been treated unfairly fair, whether it was a run-in with the law while he was in active addiction, a young-looking white kid with a decent car and a suburban address, obviously enough socioeconomic stuff to keep him afloat. The police would say, "Get out of here. Get on your way." He was treated unfairly fair. In the medical field, as I tried to chase down what was wrong with him, is he ill? Does he have some other illness other than what I suspect? He was treated unfairly fair. And when we had the chance to offer him help, he was treated unfairly fair because the resources were there for him. We know that's not true for everybody. We have to stop that, because if Harry can get well, if he can exhibit the joy of recovery, far better than the life he was leading, unimaginable to us 11 and a half years ago, why doesn't everybody get that same shot? So I don't like to say we're lucky. I do want to end on this note, and I'll toss it to Harry to tell his story. When we were asked to write our story, we wrote separately, because I said, I don't want to cloud my memory with what you were going through, and he didn't want to cloud his with what I was going through. It was only after we had completed most of the book that we read each other's sides. And I was stunned by so much, heartbroken by so much that I did not know or understand. But one line in it surprised me. I actually questioned him about it. Somewhere in there, he writes, and you know what? I wouldn't change a thing. I wouldn't change a thing about my struggles or my past. I wouldn't change a thing about having to face you and recovery and all of the rest, the fear of dying, the fear of the stigma, that maybe it would be better to die than to let you know I'm actually an addict. He said I wouldn't change a thing. I said, Harry, are you kidding me? I said, Mom, I would have changed a few things. But as Mr. Williams said last night, in these years, we are not just a family that hit this struggle and then hit recovery. We're a family continuing to heal. And I'm now beginning to learn that maybe I wouldn't change a thing because I've learned a lot. Thank you, and I'll hand it to Harry.
Good morning, everyone. I'm Harry Canan. I'm not going to go deep into my story. I am Mad's son. I'm the Vice President of Business Development at Care and Treatment Centers. And most importantly, thanks to quality care, I'm a person in long-term recovery. One of the statistics that I know my mom referenced and Marvin also referenced is, who need help, get help. And when I think about advocacy, and I want to talk a little bit today about what we can do, what we should do as members of NAATP to support Marvin, support the team, support Mark Dunn, is really education and storytelling and the marriage of the data that we can pull together in terms of outcomes from force with compelling stories. The statistic that was used is that less than 1 in 10 people who need treatment get treatment. That comes from Samson, and that same bullet point, this part often gets missed. Of those that don't receive treatment, more than 95% of them don't think that they need it. To me, that's horrifying. 1% of that's 500,000 people per percent. If we can shift that, if we can, through advocacy, through public awareness, through education, through policy, change the perception to show that treatment is effective because the data supports it. I think back to when I was struggling with an opioid use disorder. I didn't want treatment. I was ashamed to ask for treatment. And that was because I wasn't aware that it would work. I didn't know what it would look like. I had a perception of what I had seen in TV or in movies, but I didn't understand the efficacy of it. And had I understood that this is healthcare, that this is a disease, that this is a treatable disease, I would hope that I would have been much more willing to run out and get help. I think a little bit about my role was, I heard about census earlier, and I live and die by the census often. But as a field, if we think about advocacy, whether you're doing it for the right reason or not, if we can shift public perception so that more people who are diagnosable with a substance use disorder believe that they need treatment. And when we say there's 48 million Americans actively struggling with a substance use disorder in this country, you think about that number and you think about the family members and the impact that we have, there's not enough of us. Marvin mentioned 1,000 members and 18,000 providers across the country. There's not enough if we can change the perception. I want to pivot a little bit to talk about advocacy and how I see it as someone who is in this field and also the son of a member of Congress. My mom mentioned, and Marvin introduced her to talk about all of the different committees that she's on, from Judiciary to Foreign Affairs. And when I think about the role of advocacy and what we can all do to educate our policymakers and our legislators, they're asked to be experts on an incredibly vast variety of topics. Whether it's a war, what's happening in foreign affairs, the economy, addiction policy, whatever it may be, they're expected to be an expert. And our legislators are really only as good as the information that we, their constituents, give them. And that comes from the data, and that comes from compelling storytelling. If we can tell in a compelling way the stories of recovery and the efficacy of treatment, and tie that to the data with diverse perspectives of how this can work, not just for a small subset of Americans, but how treatment can be effective for all, we can make real change. I've spent a decent amount of time in D.C., and I interact with quite a few members of Congress, and both sides of the aisle, and I'll say we all know it's a pretty divisive time, and even in addiction policy, there are areas that are divisive. Treatment is not one of them. Treatment has overwhelming support from both sides of the aisle. So if you're uncomfortable or unsure or unaware of what to do, what I would suggest is to reach out to your elected officials. My mom's talking about certain bills that haven't yet passed. Mark Dunn is in D.C. every day for this organization, sharing the work that we're trying to do. Marvin talked about that center. How can we highlight how important this is? Because again, if there's 48 million Americans, every single legislator has this in their district and is looking for, begging for solutions, bipartisan solutions, and treatment is one of those. It gives everyone a win. It gives the legislators a win. It gives the country a win. And most importantly, it gives the people a win. I want to quickly end by just saying, I heard last night the idea of, staying close to the front lines. And, when I was struggling, I spent a lot of time using in Kensington, Philadelphia, and I was there a couple weeks ago doing some service work. And I see the devastation of what is happening in this country. Beyond fentanyl, we're looking at xylazine. There's so many different things out there. And I talked to a lot of different people and people from different backgrounds, and they're looking in Philadelphia at different solutions. And people ask me, it's so horrible, it's horrifying, and it is, right? But for me, I can see the hope there because I see this room, and I know that the transformational care that I received is available, but we need to be able to make it accessible, and we need to get the word out that it works so that people are seeking it. So I'm going to pass it back so that you all can have an opportunity to ask questions. I think, again, the idea of advocacy is about having these conversations. So I'm going to put my mom back on the spot and allow you all to share really what is going on. I know I talk to her constantly about some of the issues we face in this industry and the work that NAATP is doing. But I'd love for you all to have an opportunity to ask questions and to even just provide insight as to how legislators can help.
He's staying on the spot with me. So we did want to open it up to your comments or your questions. I did want to give a shout out because many of you, as I've had the chance to talk to you last night and today, gave a shout out to former Congressman Ron Klink. How many of you have dealt with Ron Klink? Thank you. He's a fabulous guy. And also to Deb Beck. I know Deb Beck from her work in addiction, alcoholism, you name it, recovery for decades because I was a Pennsylvania legislator for 6 years. So we are open to your comments or questions, and I thank you.
Good morning. First of all, thank you both for being here. I wanted to just comment on 988 and 9881. I do a lot of work in the suicide prevention space and also suicide and addiction. And I can tell you that in my 20 plus years in the space, I have never seen one initiative just rock the world like 988. It's powerful. It is appreciated. 9881. I spent some time in the construction industry talking to construction workers. A lot of them are veterans, a lot of shame. But that 988 just brings so much joy and a smile to my face. So thank you.
I'm delighted for that report, and we should actually get the numbers. Apparently, it is an extraordinary success. And when you say 9881, it's when you press 1 because you're a veteran. I have a Veterans Advisory Panel that meets quarterly. They have reported to me the difference that it is making, but our veterans are really struggling, many of them struggling with homelessness, addiction, substance use disorder. Harry talked about Kensington. We have to do more around our veterans, but thanks for that shout out for 988.
We have one over here.
Thank you. Thank you, Congresswoman, for your advocacy. I'm Emily Piper from Hazelden Betty Ford Foundation. You know, one thing that we've been really focused on recently is what are the enforcement authorities of the FTC around some of the marketing and unfair practices that providers are experiencing. We, in the last year, have had several patients through unfair marketing practices believing that they're coming to Hazelden Betty Ford and winding up somewhere else. And it's really scary, and they've been led there through terrible predatory conduct. And we're struggling with how do we work with the federal government to take action, to provide information, to encourage enforcement to shut down these bad actors.
Well, thank you for that. And we in Congress are hearing of those horror stories. But if you don't mind, I'd love it if you would share more of that with me, and I will get back to you with real good information. Okay, please. Yep, Marvin. In this world of, something else that we're working on is AI fraud and other things, the different scams that are being put forward through the use of AI and non-AI tools. But I'd love to learn more about that very scam and set of scams. More.
And you're right on point with the new NAATP program with the FTC. We have a direct link now with the FTC. They meet with us, and we can convey that information. But like the Congresswoman said, it needs to be very specific, right? We can't deal in generalities, but they are genuinely interested in this work. And just so that you all know how the ethics program works, there is an online portal on the NAATP website where you can file a complaint. It requires that you detail information, but it's there for this very purpose. And if it's an NAATP member, we will take immediate action. If it's not, we will advise of we don't have any control over those non-NAATP members. Remember, we're the short list, but we can provide some resources. But between FTC and some of our other resources, we're attacking that.
If you don't mind, you give me your contact information. Thank you very much.
Hi, I'm Ken Rotundo. I'm the founder of a company called Rehavior, and I just want to compliment you for a remarkable presentation, but I want to acknowledge the work that committed Congress people like you do. You mentioned Ron Klink. I have the good fortune of working with Ron, and Ron works for a retired congressman with a large lobbying firm, and he, for pro bono reasons, brings our company in and introduces us to people in Congress to spread the word. We have, what we've done is we've doubled, and we talk about in this industry about being more like healthcare and bringing healthcare in. Well, our company doubled colorectal cancer screening in a Black community in West Philadelphia. And Ron came across that, and he said, can you do this in addiction? And we wound up working with people in Philadelphia and in Pittsburgh in the addiction space. But if it wasn't for the Ron Klinks of the world that took time out of their busy schedule and said, this is meaningful to me. So I wanted to thank you, Paul Tonko, and others that have worked in this space. So thank you very much.
Thank you for that. And Ron Klink is an amazing former congressman, advocate for so many, so selfless. But I do want to lift up what you said. There are many in Congress who care deeply, desperately, personally, in many cases, about this entire industry, this area of healthcare. And so even though you watch us in extraordinary dysfunction sometimes, I hope you recognize the great majority of the people there are really in it for the right reasons, struggling to make sure that we do better by our constituents around these issues and others. Don't believe everything. Don't believe every hearing is the circus that you see. Just last week, a couple of hearings, just because we couldn't find a speaker for several weeks. We're not always dysfunctional. We did pass a budget with many more dollars in it around recovery and treatment and mental health. So thanks for the shout out again to Ron Klink and others like him.
Hi, my name is Chris McFarland. I'm out from the state of Oregon. I'm a clinician out there. I kind of work with the trifecta, those that are high acuity, chronic homelessness, severely mentally ill, also battling substance use disorder. Oregon has historically been at the bottom of the nation, access to mental health treatment and substance use treatment. I think we're actually 51st in the nation, access to drug and alcohol treatment, when there's only 50 states. Not sure how we get to 51st. And I'm just curious is how we can help Congress kind of increase funding, but change that stigma that it's a choice. That we hear that a lot, that to be homeless, to be battling substance use disorder, that it's all a choice. And that kind of has a direct impact on increasing funding. So just kind of curious your thoughts on how we can continue to change that stigma of that it's a choice versus it's trauma-induced.
Thank you for that. 51st. Well, I have to look at that myself. Harry and I have gone down to, as he was talking about, Kensington, and you don't have to just go to Kensington in my area to see the ravages of poverty, homelessness, mental health crises, and drug addiction. Something that we're struggling with in Philadelphia is this stigma. And I'm fearful that maybe, I don't know if you would have seen it in the news, but in our area, we have a new mayor whom I very much support, Sherelle Parker. I served with her in the Pennsylvania House, but there's a tremendous amount of pressure on her and her administration to figure out how to do better in Kensington. If you go to Kensington, it is a hellscape. I'm sure many of you have these places in your own neighborhoods or nearby. It is a hellscape of homelessness, mental health, addiction, folks who are ravaged by trank, open wounds on the ground there, and the stigma and shame as though somehow it is their fault. Do you know one of the issues that keeps many homeless veterans homeless is their discharge status as of leaving the military. If they are discharged for anything other than honorable service, their access to VA health benefits is severely limited. We're working to try to change that because sometimes think about our veterans and what they have done for us. It may be partly their service that created an other than honorable discharge, and then to cut them off as they are on the street from further help. We are re-stigmatizing folks who are on the street, re-stigmatizing those who are struggling with these different illnesses. So I think what you can do is keep talking to your members of Congress. And I have to tell you, when our story came out, member after member, Republican and Democrats, came up to me and said, let me tell you about my brother. Let me tell you about my sister whom we lost. Let me tell you about my nephew who's in recovery. Just talking about it changes the affect. Because people kind of look at you first like, your son's an addict. Yeah, it's harsh language, but he's an addict in recovery. So it's talking about it, being honest about it. And sadly, being honest about the stories of those who did not make it. We have too many friends. Harry and I have gone to too many funerals of people young and not so young who've lost their life to this. Why do we keep this in the shadows? So I ask you just keep reaching out to me and anybody. I'm trying to work across the aisle to make sure that we're all reducing stigma, ending that shame by saying it could be and is any one of us. Thank you.
Hi, good morning, Congresswoman Dean and Mr. Kinane. Thank you for sharing your story, and thank you for the bit about the Ryan White Act. My name's Mike. I'm with Woodhaven Recovery. Our focus is adolescents 14 to 18, and because of that, we work a lot with local school districts. And what we've seen since COVID is like an increase in disconnection between kids and their families and kids in the school district, specifically with after-school programs. One thing that we're trying to build is like an after-school concept that brings master's level interns from local colleges in the fields of behavioral science or mental health. So there's like a softer approach rather than disciplinary. And I would just simply welcome any information that I can bring to the mayor of Scranton at our next meeting to talk about that and help kind of make that a reality.
I would love, may I take your contact information as well? I'd love to learn more about what you're doing, but also share what we're working on. As a legislator, as somebody who, I was first in the state legislature for 6.5 years, and then ran for Congress in 2018, and came in with 4 other women in Pennsylvania, all of us committed to this area of inquiry and public policy. But we all lived through COVID, and we watched our children in their school setting become more and more and more isolated. As soon as I could go back into schools in my district, I went back in, and it was so troubling to me. I remember going in one set of schools one day, and the second graders were bouncing off the wall. It's post-COVID, they're bouncing off the wall. They're doing fine. But you go into the middle school, and then we went into the high school, and the socialization, the isolation. I literally went to a high school art class where you would think you'd be letting your hair down and relaxed. But post-COVID, they were as uptight as tight could be. And so the combination of what COVID did and now the fentanyl, the presence of fentanyl absolutely everywhere is so frightening. So I'm trying to be a part of education, prevention programs where we're talking about this. We literally have student senators who are talking to their peers because we know that the young people are going to be more influenced by somebody their age and their status than by somebody like me. So I'd love to share with you some of the things we're trying to do and learn from you also.
Hi, my name's Heather Hayes. I'm losing my voice, but I want to thank you so much for everything you do, and I really appreciate you sharing your personal side of the story too. I got sober in 1982, and my grandfather was a United States Senator, and I do believe that because of his role, it took me about 5 years longer to get into treatment than it should have because of the shame and stigma.
Yes.
Today, well, part of my story, having gotten sober at 21, was that of a teen and a young adult struggling with substance use disorder. And today our teen industry is in a complete crisis. There is a lot of press out there that is absolutely closing down some of the good facilities. There's terrible treatment going out there. We know that because of, we know that early intervention works. You know, since the pandemic, teen female suicide has increased by 50%, the deaths every day. So I just want to bring to your awareness the Stop Institutionalized Child Abuse Treatment Act that is currently in Washington. I was up there about a month ago advocating for it. It calls for regulation. It calls for protection of our kids, and it calls for helping us have good ethical treatment. Part of what's happening right now is that there's a trend that's happening that's actually decreasing the amount of treatment available to our teens and young adults. So we are really in a crisis. So I really appreciate everything that you're doing and would ask that you take a look at that for us as well.
Would you say the name of the bill again? Stop.
Hold on, I've got it right here.
And whose bill is it if you...
So I had a meeting a month ago with Senator Ted Cruz, who's taking a look at it. It is a bipartisan issue. I had a big Democrat grandfather, so I just have to throw that out there. But there's also, I don't have it on me right now, but one of the Democratic representatives, I want to say from the state of Georgia, one of the representatives from the state of Georgia, which is my home state, although you can't tell with my southern accent right now. Let me find it one second.
Maybe Lucy McBath, Hank Johnson.
It was a male.
Maybe Hank.
Maybe Hank.
I'll look for it.
Hold on, let me find it super fast. Oh, God. I had it pulled up. Oh, here, I sent it to Nikki a minute ago. Stop Institutional Child Abuse Act, Senate Bill 1531 and HR 2955, Stop Institutional Child Abuse Act. It was introduced by Representative, several, there's a whole team. Can I send you this?
Sure. Yep,
Okay,
I'll take that from you.
Thank you.
And who was your grandfather?
His name was Wilson Hall. He was from South Carolina. Many decades ago.
Thanks for his service and thanks for your words. Congratulations on your recovery.
Thank you.
Thank you.
Thank you so much for being here this morning. I'm Sherry Layton with La Hacienda Treatment Center from Texas. I'll go ahead and apologize for some of the dysfunction that my particular congressman brings. And I'm really thrilled to hear that Senator Cruz is working on something that is of interest to this group. So that's encouraging. I just wanted to ask you, you said you were talking about the MORES Act, and I tried to look it up, and apparently I didn't have the right acronym or something because I kept finding a Marijuana Act. So would you just repeat that again, please? And which committee is it stuck in so we can check the membership of that committee and see if we can do some reaching out.
This is something I'm working with Senator Casey on. Let me see. The acronym is MORE, M-O-R-E, and it's called Maximizing Opioid Recovery Emergency. And it's the More Savings Act, and it's all about lowering costs. I don't know if in the SAT side it's over in health. We're pushing for I think it might be in energy and commerce, or it might be in health. But I'm also pushing for it. We have the opportunity through appropriations and appropriations advocacy around budget time, which we just passed quite late, to fight for things like this. So this would, it's called More Savings Act, Bob Casey and Dean over on our side. And it is for an increase. One of the important parts is increase in Medicare programs. Treatment. Yeah. Thank you.
I've got another question over here.
Where are we?
Okay. Thank you, Dean. My name is Denise Burtnap, and I'm the CEO of NAATP, the National Association for Children Impacted by Addiction. And I want to thank you so much for your story this morning, for all of your advocacy and your work. And one of the things I'd ask you to remember is the children. We were promised for several years now significant funding for children's programs on both the Medicaid side and on the community grant side. And unless you're actually delivering a medication-assisted treatment, those funds are not available to communities. And so I'd ask you to really think about that. There's also a rumor out there that if children's parents get sober, that the children are going to be fine. And that's a significant rumor. Children need to do their own healing as well. They've been traumatized. They have the adverse childhood experiences. And we need to make sure that there's funding so that they can actually get treatment, that we can help communities have children's programs. We can educate schools. We can educate primary care physicians with standard curriculum around how to help children. So please remember the kids in that upstream piece, that they need to have funding as well. Thank you.
Do you mind sharing with me what are some of the most effective programs for children?
So there are a lot of them that are out there for sure, but the baseline education for educators is the piece we need to look at first, making sure that educators know about the disease of addiction, they understand substance use disorder, and the impact of trauma on children that come from homes with familial addiction. And those are basic prevention programs, and there is not significant funding out there, nor is there the time for teachers to actually have that education. Back in 1983, 1987, every school in this country had primary prevention work for teachers. That has not existed in almost 3 decades. Since the year 2000, NAATP actually did a survey of all treatment centers in this country and looked at how many of them actually provided significant care and treatment and prevention for children whose parents who went to treatment. At that time, less than 10% of them offered treatment for children. Sadly, in 2024, that bar has not actually been raised because insurance companies do not fund children's programs. You have to have significant donor bases to be able to have good children's programs. And in this room, we have 5 or 6 of them and incredible leaders who continue to do it. But at a community level, that funding is not available for those of us who do that education to be able to provide it.
I thank you for that. And as I said, I was a state legislator before I got to Congress. And as a state legislator, of course, our primary role, I thought, was funding education. I always thought that the most important thing we could do was live up to, in Pennsylvania, our constitutional obligation to provide a thorough and efficient education. In Pennsylvania, we're struggling to do that. We actually had a 10-year-long court case that was decided, I guess it was last year now, that said we were not living up to our constitutional obligation. So I stay in close touch with both the governor, Governor Shapiro, as well as the legislators, the appropriators around education. So I will be sure to push for what you're talking about. I know our education system is strapped, our administration and teachers are strapped, but we cannot forget and underfund that kind of education. Thanks for the reminder.
Hi, I'm Lisa Lackey, and I'm from Inside Out Living. It is a healing and trauma center that my husband and I started some decades ago. But my question for today, and I thank you for all the information that you gave and for sharing the story of a mother and a child and going through addiction. That has certainly been my experience as well. I guess one of the things I'm wondering about is the educational component of cultural competency for the addiction task force. I'm also very much concerned about, often when we talk about addiction treatment and addressing that in Black and Brown communities, that we're most of the time talking about those people that are underfunded, under-resourced. And I think that we forget that there are a lot of Black and Brown people struggling with addiction and mental health that don't fit that criteria and need education and different services. One last thing I'll say is, as a clinician, and I've been doing a lot of consulting work, I have the majority of my clients pre-George Floyd have been affluent white people. Past George Floyd, I did a lot of education in my communities and that kind of thing. And so I work with a lot of professional, high-achieving Black and Brown people. And when it comes time to send them to treatment, I'm heartbroken because I know that they may get good treatment, but the biggest piece that's missing is the addiction, trauma, intergenerational component. And so I'm hoping that that would be included in the conversations and in the policy.
I thank you for that. And it is. And that's why I sort of joked that it's not too much to have 3 or 4 task forces. Just literally last week in caucus and then in a separate, the bipartisan fentanyl caucus, the very issue you just talked about was part of the conversation. Phil Rutherford was on that. And in fact, he just texted me. I don't know if he knows. Phil's not here, is he? No. Okay. But those issues, that's what I'm hopeful around. Those issues are being discussed. We can't broad stroke everybody in terms of where they fit. And we have to make sure there's excellent ethical treatment for folks at every stage of their addiction, of the trauma they have suffered, all of that. So thank you for sharing that with me.
Man, do we have to?
Yeah. We have to wrap. Can I just say a big thank you to all of you, and a really huge thank you to being a part of, any small part of the NAATP 45th Annual Conference. I'm honored to be here with Harry.